18-year-old Molly, who has autism and who's been stuck for nearly 7 months in a general hospital because of a lack of suitable mental health services for children in England. Campaigners say that hundreds of young people like Molly have no appropriate support when they reach a crisis. The NHS in her area has apologised for Molly not getting care in a better environment. Our social affairs editor Alison Holt has been following the story of Molly and her family for almost a year now. This is her report.
This is Molly. She's 16 and has autism. It's at the root of her deep anxiety and eating problems. I've been talking to Molly and her parents since last summer. Their experience exposes a health and care system which is failing too many young people.
Mental health services don't do anything until you're almost dead.
There's no long-term strategy, there's no planning really other than reacting to crisis.
The Queen Alexandra Hospital in Portsmouth is a busy general hospital, not a mental health unit. Yet Molly has spent most of the last 7 months in a side room on a children's ward here. Her sensory needs mean she usually sleeps on pillows and cushions on the floor. She was here mainly because there was nowhere else suitable, but this environment overloads her senses. When she becomes distressed, her behaviour can be challenging. She's been restrained numerous times.
It feels like they're torturing you. The hospital room is like a small box and you're not allowed to leave, and there's phones going off, alarms, children screaming.
This was Molly speaking when she was at home last August. It was when we first met, and she had already spent 90 days in the same general hospital. Why have you decided that you want to talk to us about this?
This shouldn't happen to anybody, and that the system really needs to change.
This sort of mind map, isn't it?
Yeah.
In the last 4 years, Molly has also spent time in 4 different mental health units for young people. She wrote this in the last place.
Only 2 visits a week for 2 hours.
Her family feel none of the units provided her with the therapy or autism support she needed.
Constant alarms, no one understands autism or any of my needs. Sessions don't happen.
But back at home, Molly's family say the mental health support she got was patchy. Her weight dropped, and last October she was sectioned and taken to the general hospital. Molly's parents asked us to delay telling her story, hoping she'd be home soon. But by this April, she was still here. With little else to do, her artwork and thoughts reached across the floor. To keep her safe, agency mental health nurses watched her 24 hours a day.
It's a vicious cycle, so the more distress she gets, the more her behaviour becomes more challenging, and then the more intense support they put around her, which is more oppressive and more sensory overloading.
And do you think that's then adding to her problems, traumatising her?
Yeah, definitely.
Yeah, definitely. Being restrained regularly is really, really traumatising.
And despite the close supervision, she's tried to take her life several times.
I think we know something's wrong before we even answer it if the phone goes at night. We just know, don't we?
It's pretty desperate, pretty miserable. It's really, like I say, it's on your mind 24/7 because...
You're exhausted, aren't we?
It's exhausting. We're in that situation where, like I say, we're kind of almost waiting for a bad phone call.
At the National Autistic Society, they say they are hearing hundreds of stories like Molly's. They describe it as a human rights crisis.
Molly's there again because there is nowhere else. Because there aren't the right support services in the community, so people to either have their own house or their right support to live at home with their parents, with people going in to provide additional support, and a bit of support from a community mental health team. Those things just don't exist properly for autistic people.
Steve Crocker represents directors who run council children's services. Until recently, he ran services in Hampshire, where Molly lives. He can't talk about her case, but says health and care teams are seeing a rapid rise in young people with mental health issues.
We need to work together with the families to try to understand the children's needs. We also need to push government for a full review around children's mental health services so that they can get a better deal.
Last month, Molly's family says her behaviour became so distressed the whole of the children's ward she was on was closed to other patients. 10 days later, she was moved to a mental health unit, even though that hasn't helped in the past.
It's ruining her life. She's been in this kind of loop for 4 years or more, really, it seems, going round and round, in and out of hospital, and costing an absolute fortune.
The NHS in Hampshire says Molly's safety has been its priority and everyone involved is doing their best to provide compassionate care. And with the right support, life could be different for Molly.
What are your hopes for the future?
To stay out of hospital and go to college. I don't know.
Enjoy life, I hope.
Yeah.
The government says it is investing in community services and recognises that people like Molly need the right support in the right place.
Alison, how many more Mollys are there out there?
Well, Rita, that's really difficult to say. There are no solid numbers around this, but certainly I've spoken to quite a number of families who have had children in similar situations. I've been worried about getting the right services for their young people. And as we heard from the National Autistic Society, they're getting hundreds of calls raising similar concerns. Like Molly's parents, the families I've spoken to are generally distressed. They're worried that their children are ending up in the wrong place, perhaps on a general hospital, perhaps in a mental health unit. They're not geared up for someone who has autism and they fear it compounds their problems. For a long time, we've had the promise of the right support in the community built around the individual and their needs, but that's not really happening on the scale that's needed yet. In Molly's area, they are building new services. They have those plans in place, but generally the NHS and care system is struggling to find staffing. On a more positive note with Molly, I spoke to her a couple of days ago. She's been out on trips with her family and now she just wants that plan for the future so she can get on with life.
Alison.